There is an unmet need for treatment of advanced mastocytosis, and that's because of the toxicities associated with cladribine and alpha interferon and inability of imatinib to inhibit the D816V mutation seen in the majority of patients with advanced varieties. So that brings us to the question of what would be the most appropriate target to cure this disease. And the obvious answer is an inhibitor that works against the D816V mutation. And the research has focused on tyrosine kinase inhibitors with specific abilities to inhibit the D816V KIT mutation. One such inhibitor is midostaurin, or PKC412. So this is a kinase inhibitor. It is a multi-targeted kinase inhibitor. It is not specific for KIT or even tyrosine kinases. It inhibits a variety of other kinases. But it also inhibits D816V and wild-type non-mutated KIT versions. Because of that reason, there has been a lot of interest in trying this medication in mastocytosis. There are other candidate drugs that work more specifically against the D816V mutation that are in early stage clinical trials. But midostaurin appears to be the most advanced along the clinical trial and the approval process at this point. It has not been approved by FDA yet. It is currently under review.
The reason why midostaurin was tested in ASM was based on work done in the laboratory, actually, of Dr. Gary Gilliland years ago, who's now head of the Cancer Center at Fred Hutch, who was looking for tyrosine kinase mutations and drugs that could inhibit them. And midostaurin was shown to inhibit a D816V, or cells that were transformed by the D816V KIT mutation, as well as a lot of other tyrosine kinases like FLT3. So it was known to be a D816V inhibitor. Now, imatinib is a tyrosine kinase inhibitor and inhibits ABL, was thought to maybe be a KIT inhibitor, but it wasn't very effective in systemic mastocytosis because it's not a very good KIT inhibitor. Some of the second generation ABL inhibitors, namely dasatinib, are KIT inhibitors as well, and dasatinib does have a role in some patients with systemic mastocytosis, but it's not very effective. So if you're looking for an effective D816V inhibitor, midostaurin was the logical choice.